Hello everyone. This presentation is about the impact of the Affordable Care Act on healthcare, and it's done by Yamini Raju, Karen Clift, Ashley Haffelfinger, and Diana Kausari. The most important lesson that everybody has learned is the fact that the goal for healthcare in the United States is to have good quality and cost-efficient care that is accessible for everyone. The Affordable Care Act, also known as ACA or Obamacare, is trying to make that dream of healthcare in the United States into a reality. The purpose of the Affordable Care Act is to make health insurance more affordable for people living in the U.S. that have little or no coverage. It's true that majority of the people in the United States did have health insurance before the ACA became a law, but it is important to remember that ACA is mainly trying to target the people who don't want to buy health insurance or who could not buy health insurance, or the people who have healthcare coverage and don't want to protect themselves from high medical expenses. Along with access to insurance, increasing consumer protections, and emphasizing prevention, ACA also is trying to improve system performance, expand the health workforce, and curb rising healthcare costs. So it's clear that we should assess how ACA impacts the U.S. healthcare today. So in this presentation, we will take a closer look into questions like, who is newly covered? How are different states approaching exchanges? What does the Medicaid program have to do with ACA? How will health insurance premiums be affected? What variables play in the political debate over the impact of the ACA? And what challenges are facing state and national policymakers? In the end, we will conclude with if ACA is a favorable or an unfavorable law.
Who is newly covered under the American Care Act? Younger people with the median age of 33, less educated with only 15% having a bachelor's degree, low income earning less than $19,000 a year for an individual, and less than $40,000 a year for a family of four. 42% likely to have a full-time job, 33% speak a language other than English, and 25% will be in the minority population. How is this new coverage expansion achieved? The ACA reduces premium costs to make access to healthcare more affordable. They cap out-of-pocket expenses. There is a maximum amount paid by an individual. Preventative care is now fully covered. Government bans coverage denial by insurance companies based on an individual's pre-existing health conditions. It also allows consumers to appeal insurance companies' decisions to not cover any medical costs. What are exchanges? Exchanges are marketplaces that are established for consumers to purchase health plans. American Health Benefit Exchanges to facilitate the purchase of health insurance by individuals and employers under the Affordable Care Act for states electing to establish an exchange. The exchange must be established and meet certain minimum requirements by January 1st, 2014. In states that do not establish qualifying exchange, the ACA requires the Secretary of the U.S. Department of Health and Human Services, or HHS, to establish and operate an exchange for the residents of that state. How are different states approaching these changes? In the state of Massachusetts, they have a quasi-governmental agency model. An independent public entity established and open under state laws, not under any agency or department, run by a board consisting of 10 members, including 4 public officials, 3 members appointed by the governor, and 3 members appointed by the Attorney General. The state of Utah is operated under a pre-existing state agency, the Economic Development Agency. It has a separate advisory board for the Economic Development Agency. The advisory board consists of 8 people from insurance companies, insurance agents, consumers, and representatives of the state insurance department, as well as representatives from the state health department. Different department for risk adjustments are staffed by representatives from health insurance companies, employers, consumers, and experienced voting member with healthcare policy and insurance knowledge. Other states have high-risk pools, 35 states, independent public agencies such as California, and public corporations in unit with the state government such as Maryland.
Expansion of Medicaid under the ACA. So what does Medicaid have to do with the ACA? Well, the ACA expanded Medicaid coverage to about 14 million of low-income Americans. Before the ACA, Medicaid was only limited to specific low-income people such as the elderly and the disabled. However, that has changed, and the new eligible adults under Medicaid are families of 4 or more earning $30,000 or less per year, and individuals earning 15 or less per year are also covered. Supreme Court and ACA. In 2012, the Supreme Court ruling on the ACA allowed states to opt out of the law's Medicaid expansion, leaving each state's decision to participate in the hands of the nation's governors and state leaders. As of January 2016, 32 states have adopted Medicaid expansions, and 2 states are under discussion, while 17 states have not adopted Medicaid expansions at all. Maryland is an example of the 32 states that had adopted Medicaid expansions under the ACA. On May 5, 2013, Governor O'Malley signed into law House Bill 228 to fully implement the Affordable Care Act. There have been 2 other states that expanded Medicaid coverage via alternative plans, and one of those is Virginia, which has now expanded Medicaid coverage to low-income adults at this time. However, Virginia introduced another plan that extended limited benefits focused on behavioral health services to adults with incomes below 100% of the poverty line and with severe mental illnesses. Financing Medicaid. Insurance premiums. How will insurance premiums be accepted? The federal government will provide subsidies paid through taxes in order to lower the amount spent on premiums and to reduce the out-of-pocket costs. You may ask, how can I qualify? Well, in order to qualify, you have to live in the United States. You have to be a U.S. citizen. You have to be not incarcerated. And your combined total household income has to be between 133% and 400% of the federal poverty level. People with incomes below 133% of the federal poverty level will qualify for Medicaid in most states. In addition, the federal poverty line ACA subsidies bracket will determine the maximum percentage of your income that can be spent on health insurance premium. Individuals and families who qualify have to purchase quality insurance plans from marketplaces. Also, the government will pay for the second least expensive Silver Line healthcare plan, and if the premium exceeds your maximum amount to spend on premiums, the government will pay for the rest. Furthermore, subsidies can be applied to any available marketplace, and people can choose to pay the full premium or take the credit for themselves when filing taxes. Something very important that states need to consider is that the Medicaid expansion population will be paid 100% by the federal government for calendar years 2014 through 2016. However, this federal contribution decreases over time, with the federal government paying about 90% and states paying 10% beginning in calendar year 2020.
What variables are in play in the political debate over the impact of the Affordable Care Act on cost, access, and quality of care? The Affordable Care Act set out to remedy two problems: coverage and cost. Before the Affordable Care Act, traditional health care was costly and full of waste. Third-party payers, that is insurance companies, managed care organizations, Blue Cross and Blue Shield, and the government, paid the medical bills. Under the fee-for-service model, every lab test, procedure, or cotton swab initiated a form of payment. The Affordable Care Act encouraged the use of a variety of tools and discouraged unnecessary charges. Providers would receive financial rewards for cutting costs and penalties for poor care, such as readmissions. The law actually requires greater price transparency. The Medicare expenditure for each beneficiary has actually declined from $12,000 in 2011 to $11,200 in 2014. Under the Affordable Care Act, doctors and hospitals and healthcare providers are encouraged to join together in an accountable care organization that focuses on keeping patients healthy by providing high-quality care to the Medicare patients. The Affordable Care Act rewards them for keeping costs below a fixed limit per person. The RAND Corporation actually reports that in 2014, there was a fall in Medicare spending, and it was valued at $98 billion. Affordable Care Act trends and predictions. If the law goes unchanged, the net federal spending for the government's primary health care programs in the year 2039 is predicted to be 8% of the GDP, approximately 15% less than had been predicted in 2010. Forecasts for Medicare and Medicaid expenditure between 2011 and 2020 have been revised down by $1.1 trillion. The government reports that since 2011, about 50,000 fewer patients died in hospitals as a result of the Affordable Care Act. The Affordable Care Act and quality of care. Quality of care as defined by the RAND Corporation is care that's likely to improve health and is consistent with current medical science. The White House reports indicate that quality health care is improving quite rapidly. Some examples would be from 2010 to 2013, 50,000 fewer people died as a result of preventable errors and infections in the hospitals. With that in mind, the government further reports that since 2011, approximately 50,000 fewer patients died in hospitals, and this is because of the Affordable Care Act. Moreover, Medicare is creating star ratings for health plans and healthcare providers. This helps to improve provider performance and information given to patients. As a result of new care models, patients are able to spend more time with their physicians. Primary care, medical homes, and ACOs help to promote quality care by providing support to patients when needed. An example would be in 8 states, comprehensive primary care models allow patients to contact their physician's offices 24 hours a day, 7 days a week. The Affordable Care Act and access to care. The Affordable Care Act has improved access to Medicaid recipients, those with chronic conditions, as well as women. As a result of the Affordable Care Act, lower-income Americans earning less than 133% of the poverty level will be eligible to enroll in Medicaid. Americans with chronic and pre-existing conditions will also have access to much-needed preventive care. With respect to women, in August of 2012, 47 million women gained access to preventive care services and screenings without incurring any additional expense. Finally, the Affordable Care Act promotes individual responsibility by requiring Americans who can afford health insurance to obtain coverage or pay a fee. If affordable coverage is not available to an individual, they will be eligible for an exemption.
Now, let's discuss how ACA has affected the state and policymakers. Individual mandate is the policy that is part of the ACA law that says all people in the United States have to get health insurance. Even though insurance companies can no longer deny insurance for people with pre-existing conditions, some people in the United States still don't agree with this policy, especially the people that are part of the younger generation and others who think it is unnecessary to purchase health insurance. Of course, affordability of health insurance comes into the picture for these individuals, which will cause less people to enroll into an insurance plan. This is also known as anemic enrollment. This is because some people, like people who have lower income, don't want to spend their money on health insurance when they're struggling to manage their daily living costs. Adding to that, insurance companies increase their premiums because now they have to accept people with pre-existing conditions. So policymakers have to figure out alternative methods to help insurance companies manage costs and to make people accept ACA and individual mandate. Medicaid expansion was spoken about earlier in this presentation, but it is a topic that policymakers and the state are constantly assessing on how to balance costs to accept people that are newly enrolled into Medicaid. After assessing the pros and the cons, we concluded that the Affordable Care Act is a favorable law, but it definitely has potential to become a better law by making some changes. The Affordable Care Act is favorable in the sense that it allows parents to cover their children until they are 26 years old, allows people with pre-existing conditions to get health insurance, and allows for more preventative care to be covered. But the Affordable Care Act could be better in controlling overall costs by decreasing health premium rates or by decreasing the fines for not having insurance. It will also be nice if the ACA enrollment process is easier and more rules can be established so that the government has more control over the Medicaid expansion.